Hello, I'm Charlinda Bennett, and I'm going to be doing a physical assessment. And first, I would start by washing my hands. I'm going to be doing an assessment on you. Is that okay?
Yeah.
You're going to ask questions at any time.
Okay.
Can you tell me your full name?
Nicholas Scott Bennett.
Um, can you tell me what day it is?
It's Thursday.
Can you tell me who the president is?
Donald Trump.
And can you tell me why you're here?
For an assessment.
Okay. Mr. Bennett is alert and oriented times 4 to person, place, time, situation. His mood appears pleasant. Um, his vital signs were 125/65. Temperature was 98.4. Respiration 16. Pulse ox 100%. And his heart rate was 86. Are you having any pain right now?
No.
And he's not having any pain. So right now I'm just going to check his skin. Doesn't appear to be any rashes or nodules. Skin is warm and dry. And pretty much uniform color throughout. On his hands and arms, he's a little bit tan. Um, Head is normal cephalic, symmetrical. Uh, Hair is slightly wavy, evenly distributed. Scalp is white. No signs of any parasites. Any tenderness?
No.
Okay. Um, Eyes are symmetrical, upper third of the face. Mouth is lower third. Nose is midline. The neck is midline. Um, Now I'm just going to check his carotid arteries one at a time. Now I'm just going to listen for any signs of any abnormalities like a bruit. Can you hold your breath for me? Okay. No signs of any abnormalities like a bruit. The rate is regular. It's strong. It's equal bilaterally. Now I'm just going to check his lymph nodes here. The preauricular, posterior auricular, occipital, tonsillar, submandibular, submental. We got superior cervical, posterior cervical, got supraclavicular. Do the deep cervical chains one at a time. Any tenderness at all while I'm doing this?
Mm-mm.
Okay. No tenderness noted. No swelling noted. Now this time I'm just going to check your eyes. Usually we dim the lights. I'm not going to turn the lights out because it would just darken the whole room. But this light here is actually dim, so I can actually assess for perla easily. Just going to shine this light in your eyes. The pupils are 3 millimeters, reactive to light. Can you stare back at the wall for me?
Mm-hmm.
Okay. So pearl is intact. Pupils are equal, round, reactive to light, and accommodation. I'm just going to look at the sclera here. The sclera white, conjunctiva is pink, moist. And if I was to assess with an ophthalmoscope, I would be looking for his optic disc and his macula, ocular fundus, um, like the retinal vessels. Um, and then usually when you shine the diopter, you get a red light reflex. So I want to go ahead and check your frontal sinus, maxillary sinuses. Any tenderness?
Mm-mm.
Okay. I'm going to go ahead and check his tragus here. Mastoid process. Any tenderness?
Mm-mm.
I'm going to shine the light in. There's no signs of any drainage, no redness, no swelling, no piercings. Ears are symmetrical bilaterally. If I had an otoscope, I would pull the ear up and back, hold the otoscope upside down. Be looking for the tympanic membrane, which is the eardrum. It's a pearly gray. And you would see a cone of light on the right side at 5 o'clock and a cone of light on the left at 7 o'clock. Okay, just have you lift your chin up for me. Go ahead and check your mouth here. His uvula is midline. I don't see any exudate or swelling in his tonsils. They're about a 1. His tongue is rough. The dorsal side of his tongue is rough and moist on the top. Can you raise your tongue up for me? And it's shiny, and you can see the veins here on the ventral side. Um, Now I'm going to go ahead and check his lung sounds here. Also, I'm going to assess his spine. Can you turn to the side slightly for me? His spine is midline. And if I look at the lateral side, I can see the S shape that it makes. The anterior posterior to transverse is 1 to 2. I'm going to check for chest expansion. You take a deep breath. Chest expansion is equal bilaterally. Also going to check for tactile fremitus. You said 99 for me?
99. 99. 99. 99. 99.
I'm not hearing any abnormal vibrations. The sound is equal bilaterally. I'm going to go ahead and listen to your lung sounds. And I'm going to have you breathe a little deeper through your mouth on inspiration. You can take a break for just a second. Okay. Take a deep breath.
Incoming baby.
Okay. Okay, I'm going to go ahead and check the front. Take a deep breath. Okay. Take a rest for a second. Okay. Awesome. I'm going to check the side here. You let it out. Okay. You can breathe. Okay. Vesicular breath sounds are present in all peripheral lung fields bilaterally, anterior and posteriorly. No adventitious sounds are present. I'm going to go ahead and percuss the lung fields here. You turn to the side for me. Any tenderness? Okay. No tenderness present. Um, at this time, I'm just going to assess the precordium and listen to heart sounds. I'm going to be listening in 5 spots. The aortic, which is at the second intercostal space, left sternal border. And then the pulmonic, which is the second intercostal space, left sternal border. I'm going to be listening at Erb's point, which is the third intercostal space, left sternal border. And tricuspid, which is the fifth intercostal space, left sternal border. And then at the mitral, which is the apex of the heart, which is the mid clavicular line at the fifth intercostal space. And I'm going to listen for S1, S2 sounds. You can breathe normally. I'm just checking your heart. Okay. I checked all those, and so far there's no signs of any abnormalities, no murmurs, um, no um, no other sounds. Um, at this point, I'm gonna check the PMI. I'm gonna palpate uh, this area here. PMI is not palpable. And now I'm going to check the apical pulse. I do not have a watch, so I'm going to use my phone and set the timer. Can you set the timer for me? Okay, I'm going to listen to his apical pulse for 1 full minute. Okay, his heart rate was 90, was a regular rate and rhythm. Um, I'm also going to listen here with the bell. So, okay, still again, everything sounds normal, regular rate and rhythm, no signs of any murmurs. Um, at this point, I'm going to have you just lay back for a little bit on your back, and I'm going to check your abdomen. Now, I'm checking his abdomen. Um, it's flat. There's no signs of any rashes. There is a scar here on the lower left quadrant, and that's from an old four-wheeler wreck. And now I'm going to auscultate next after inspection, um, just to make sure that his bowel sounds are accurate before I start palpation. Okay. As bowel sounds are active, normal is 5 to 30 in a minute. I just heard at least 5 to 6 in the short time that I checked in each quadrant. Um, Also, he's got his umbilicus is midline and it's inverted. Um, the organs in all the quadrants. You have the liver and gallbladder in the right upper quadrant, the appendix in the right lower quadrant. Left upper quadrant would be the stomach, spleen, and pancreas, and the left lower quadrant would be the small intestines. This time I'm going to do some light palpation. Any tenderness? Any pain?
Nope.
Okay. I'm going to have you go ahead and sit up. Now at this time, I'm just going to check his pulses. And I also want to check his capillary refill bilaterally in his fingers and his toes. So right now I'm just checking for clubbing. There's also no signs of cyanosis. Capillary refill is less than 3 seconds in the fingers bilaterally. No signs of clubbing. His nails are translucent. They're convex. They're trimmed. And the nail bed less than 160 degrees. And that's how I know there's no clubbing. Now I'm just going to check your radial pulses bilaterally. And those are 2+ bilaterally, the regular rhythm. I'm just going to check his brachials. These are a little bit harder to feel. These are 2+ as well. They're normal, regular rate rhythm bilateral. Now I just need to check his legs for any signs of swelling and check those pulses as well. We'll go ahead and check your legs. It's got a little red scar here. And I think that's from a dirt bike wreck. Hair is evenly distributed on the legs. Let me see this leg. No signs of swelling. Any tenderness or pain. No lesions. I'm going to check his posterior tibial pulses. Those are 2+. Equal, regular rate and rhythm bilaterally. I'm going to check dorsalis pedis. You just sit your feet up here on the side of the bed. These are a little bit harder to find. And these are 2+ regular rate rhythm bilaterally. Now I'm just going to check his toes here. Capillary refills less than 3 seconds bilaterally. You can go ahead and sit. Do you have any questions?
No.
Okay. That's the end of my physical assessment with Mr. Bennett. Everything here's okay. Thank you very much.